My name is Dag Eklund. I'm the Senior Project Manager and also Acting CEO of ScioVR. I will have a short PowerPoint to tell you about the company and especially the projects that we run. And then I will start a short film to actually show what we are doing. All right, you see the first film, the first image, and this is actually my colleague Matthias operating on a virtual patient. The company started in August 2015 by 4 VR entrepreneurs. And we are into simulations, visualizations, and serious gaming, especially for science. You see our background from EdTech, an EdTech company called Sensavis. Okay, sorry, I was a bit far. We have already had a few customers, Nobel Foundation, Karolinska, and especially the South General Hospital, SÖS, to us in Stockholm, and also the SKL, Swedish Association of Local Authorities. Yes, you can read for yourselves. The most important project that we run is the virtual operating room. We also do assignments for SQL, films, mobile webs, and I think we're talking about a game as well. But this is what I'm going to talk about tonight. The virtual operating room, short VOP. You see an image from the actual operating theater, operating room, captured by photogrammetry. That is one of the techniques that we use to get all the dust in the corners and broken equipment. So, what is this all about? The virtual operating room. It is the project is to reduce the number of care injuries after surgery, because that causes great suffering and also, of course, great costs, high costs. Every 10th care bed in Sweden is occupied by a patient suffering from care injuries, and that's a lot of patients all the time. And to be able to reduce these care injuries is a vital task and also an important task.
Sorry, could you define care injuries?
I mean care injuries after surgery. Especially, that's what we are aiming at. But I mean, there are care injuries after medical care as well, drugs and so on. But especially surgery, and we are starting with orthopedic surgery.
Okay.
And this is perhaps the essence of the program: virtual team training. So it's a long sentence. Which hopefully captures most of what we are aiming for. So I'll read it, even if I know that you can read. The virtual operating room will radically improve the ability of the operating team, in groups or individually, on site or from a distance, to virtually train technical and cognitive skills. And cognitive skills are like soft skills, communication, follow routines, and things like that. Technical skills is, for a surgeon, the actual craft of operating. There are some unique features about the virtual operating room. First and mostly actually is the ability to train technical skills and these soft skills at the same time. And it sounds perhaps I don't know, easy or obvious, but that isn't the fact today. It used to be like that because earlier operating teams, surgeons in training, they trained during actual surgery. And that is no longer considered ethical, so we have to find alternatives. So very rapidly, clinical training centers have been built around the world. And that is a good thing, but it's hard to replace the actual volume of training during surgery. That is almost impossible, at least. There are some more features like gamification curriculum, the real-time, the essence of the real-time program, the distributed, the distributed use and distributed environment, and actually also that you could have a virtual theater that mirrors an actual theater, an actual operating room, for some sort of training that is could be important, and for if you are training efficiency, it will be important. So please, if you have any questions, I have enough time to answer questions whenever you want. So the most for most the most what to say the most important thing is the combination of tech skills and soft skills in the virtual environment, so that surgery can be trained in one session. No need to change physical site. And also that team members can train their own skills together. It's not all about the surgeon, the orthopedic surgeon. It's also the scrub nurse and the anesthetist. They should also be able to train their skills from their own perspective.
Are there sessions where they train together or always separately?
We are thinking of both. I guess that we will start letting them train together to train together, yes, because it is much more work to have, for instance, a scrub nurse to train with the computer acting as a surgeon and anesthetist. So for money reasons, at least, I guess it would be a later step. But very, very important, perhaps the most important thing is the possibility to train alone. And the gamification curriculum, yes, you are probably familiar with games, and like the framework will support avatars, voice, instant feedback, leveling, all these clever things developed by the gaming studios, or perhaps not developed, but the features that they use. Of course, it must be a strong focus on metrics. We have to measure things. Talking about cognitive skills, it's important where you look. If I'm a scrub nurse or if I'm a surgeon and I talk to the scrub nurse, but I look at that direction, that is no good. You have to look you have to look the scrub nurse in the eyes, and that is possible to measure. That is one example. But also to make it fun to train, to have the high scores list, the possibility to level. These are, at least the orthopedists, the surgeons, they are very competitive, and they we think they love the idea of a high score list in somewhere. Let's see. Well, distributed gaming solution, I talked about that. It's a possibility to train wherever you are in the world, actually. and also for instructors and more scarce resources, like a teacher or the surgical star doesn't have to be at the actual training center. It could be somewhere else, at his own hospital or at home even. About the mirroring, yes, for efficiency routines and so on, it could be like robotic surgery. It's a very strong focus on money or saving time to afford this expensive equipment. There is a value proposition, of course. It's a highly scalable solution. It's a little effort to add new type of surgery. We are doing hip fracture. A simple hip fracture is a common hip fracture called cervical hip fracture. And to add a new type of surgery, I only know the name in Latin or Swedish Latin, trochanter hip fracture, a bit lower. It's not big. It's not a big deal to add that. We're talking about methods, and methods often are the equipment. I mean, we are using screws called Olmed for this operation, and there are similar screws and Hanson pins and whatever. And these methods, this medtech equipment, is very often linked to the suppliers, to the OEM suppliers, to the major 6 or 7 suppliers in the world. And for us, that would be a small, little effort to add new types of surgery and new types of methods. But it's about reducing costs and to rise training volumes and rise the quality of training. Okay, I think I'll finish there. I see I'll show you a film. I'll show you a film so that you actually can feel a bit what it's all about. And by the way, this is not our idea. The idea comes from SÖS and especially from Italo Masiello in the film, and he's sitting in the audience. Start it from the beginning. Is it on?
Jag får inte igång ljudet.
Okay.
Jag kanske kan berätta vad som händer.
Okay. Sorry to say the sound is gone. Let's. Okay, I'll look like this. Here is the surgeon operating on a virtual patient with like haptic devices, tactile devices. Here is Italo, our potential customer, talking about it. There he uses the drill and I don't name in English the other tool to find the hip. He could actually feel the hip in the virtual environment, so he could feel the fracture, not a fracture, but where to insert the drill. Here is an orthopedist in training. There is feeling the bone. Italo talking about what's important, and that is especially the possibility to train tech skills and soft skills at the same time, and that hasn't been done yet anywhere. as far as we know, in a virtual environment. So sorry for the speaker that didn't appear.
My bad.
Oh, and one thing about what we are doing now is that we are porting it to gaming controls. Here you have haptic, tactile controls, but the future, a big deal of the future is in gaming, ordinary gaming controls. We are porting it to HTC Vive, which is good. It works perfectly, and we are also adding new modules like X-ray. But this is essentially a demonstrator, and it's a lot of work to have it as a prototype or functional prototype. Time out. Thank you very much. And in the break, I hope you talk to Dag and ask a bit more.